Good afternoon, everyone. My name is Jeff Cooper, Public Health Dayton and Montgomery County Health Commissioner. Thank you again for being here. As this situation rapidly unfolds globally across this country, in our state, and in our community, we believe that as a system of partners gathered here today, that it's important to speak with one voice, one location, and update our community to where they don't have to search multiple venues to get up-to-date information. So I'd like to thank our partners for being here today. I'll make some opening comments, and then our Director of Environmental Health at Public Health, Jennifer Wenzel, will be providing some updates. I'm going to move this. Jan Kelly, Director of the Montgomery County Board of Elections, will be speaking, and then Mark Owens, Clerk of Courts, Dayton Municipal Court, will be speaking. Okay, so the Governor gave his news conference again today at 2 with Director Acton from the Ohio Department of Health. We've seen the numbers continue to change, and that will happen every single day. Nationally, over 1,600 cases of COVID-19 throughout the United States, 41 deaths, 46 states. Ohio now has 13 confirmed cases. And Dr. Acton gave the range of those ages, 34 to 66 years, 4 hospitalizations of those 13 confirmed cases. They're distributed throughout 6 counties. 0 deaths, and that's very encouraging. And as of today, 159 persons under investigation within the state of Ohio. We need to put those numbers in context. And please don't think that we're dismissing the significance of COVID-19. But this flu season alone, for seasonal flu, nationally, 36 to 51 million illnesses, 370,000 to 670,000 hospitalizations, 22,000 to 55,000 total flu deaths, and very disturbing, confirmed cases, 144 pediatric deaths so far this season nationally across the United States. In Montgomery County, to date this season, we've had 736 influenza-associated hospitalizations. So yes, we're in a national emergency, public health emergency regarding COVID-19, but we can never dismiss the burden that seasonal flu takes on the health of our population. For Montgomery County, we remain at 0 cases. Let's just get this out there. That will change in the coming days. We have community spread. The Ohio Department of Health has already told us, based on the best evidence out there and their models that they're using, about 1% of Ohioans are currently infected with the virus. So we know our population. That puts us at around perhaps 5,000 individuals throughout Montgomery County that likely have the virus. So it's really no longer about counting cases and identifying persons under investigation, because the numbers are going to just continue to grow. It's about slowing the spread of disease, slowing that disease transmission, make sure that we don't overwhelm our healthcare systems, and that we can continue to provide essential services to our community. So, as we end this week, let's quickly revisit the basics, because some individuals may be hearing this, they haven't heard it a lot, and it may be that they need a refresher on how this spreads. What are the symptoms they need to watch for? What do they do if they're sick? How do they prevent illness? There's so much information out there that we need a credible source. And that credible source is Public Health Dayton and Montgomery County for this community. So it spreads person to person. Close contact, respiratory droplet. People are most contagious when they're most sick. And yes, it can exist, the virus can exist on contaminated surfaces. However, that's not the main route of exposure. It's droplet spread. Someone sneezes or coughs directly onto someone else for the most part. So watch for symptoms. Symptoms usually appear 2 to 14 days after exposure. So it's fever, cough, shortness of breath. And those symptoms can range from mild to severe. So what do you do if you're sick? Stay at home. There's an exception there. If your symptoms are severe and they continue to worsen, then you stay at home until you need to get medical care. We're not saying no one should get medical care, but for the vast majority of cases, it can be managed at home. Avoid contact with others. Do not share personal household items. Don't drink out of the same glass, etc. Cover your coughs and sneezes, and then keep your surfaces that we routinely touch, keep those clean. So how do you gauge how sick you are? If you just have a cough or mild symptoms, and you have no contact with anyone else who's sick, don't automatically assume that you have COVID-19. Stay at home, take care of yourself, and see if you improve. However, if your symptoms get severe, then obviously contact your medical doctor, your physician, for advice and follow-up. So how do we prevent illness? Wash our hands, right? We've been saying that from day one. Wash your hands often. It's difficult, but avoid touching our face because we want to keep our hands away from our eyes, nose, and mouth. I think we're all becoming better and more aware of the fact that we now notice when we touch our face, and we're like, oop, we shouldn't be doing that. That's important. This messaging works. Avoid non-essential travel. And this one seems really simple, but it's very, very important. Practice healthy habits. Seriously, get plenty of sleep. Be physically active. Drink plenty of fluids, appropriate fluids, obviously. Eat nutritious foods, and manage your stress. We're going to make a slight exception to that eat nutritious foods. Yes, public health is all about promoting fresh fruits and vegetables and healthy eating per se, but in desperate times, it's okay. We can have chocolate. And one of our speakers today awarded us with that. So, it's pretty clear that together, we're becoming very familiar now with these unprecedented social distancing measures that are needed to protect all of us, all right? Protect everyone here, your families, your neighbors, your friends. We have to protect each other. We've heard about what's happening with K-12 schools in a 3-week closure, university distance learning, and those students leaving campuses. County jails and correctional facilities today, by the governor order, no visitors. Nursing homes, no visitors. Juvenile courts, looking at similar protocols to nursing homes and correctional facilities and county jails. Limiting crowd size to no more than 100. Indoor, outdoor settings, as well as public-private settings. That's significant. The governor today mentioned a variety of comments around daycares, informing daycares to start preparations. We don't know what may happen, but he's giving early warning there may be some potential changes in daycare operation. So guidance is out there from the Ohio Department of Job and Family Services. Daycares need to begin to prepare. And I think it was really important what the governor indicated. As we get more and more testing results, as private labs have test results, the Ohio Department of Health releases these results, they should not surprise us. They're expected. We are going to see more cases. So public health is doing our part as well. These are very challenging times. Our mission is to serve this community, make sure that vital public health programs and services are provided to our citizens. But like everyone else, we need to make sacrifices as well. So all of our public health sponsored public events are now canceled through April 30th. And we are taking actions like everyone else in this room to make sure that we protect our workforce and we look at options for flexibility to accommodate our workforce, because some of our employees as well are affected by these social distancing orders. So, again, the website for up-to-date information is phdmc.org. We also have an information line that we operate, 937-225-6217. It operates Monday through Friday, 8 to 4 p.m. And especially important, because we continue to receive an increase in calls, public health does not diagnose, test, or treat for COVID-19. So please contact your physician.